Today, we will be discussing how standardized reporting contributes to the safe transfer of care from the operating room to PACU. By the end of this lesson, you should be able to state 4 out of 6 reasons a structured process for patient handoff is important, identify 10 pieces of information that should always be included during a handoff report, explain 2 attributes to effective handoff, and create a standardized patient handoff report for your department. Your goals for this lesson are to incorporate safe patient handoff strategies that will reduce risk to patient safety and effectively design a patient handoff report. Why is patient handoff so important? It reduces the omission of patient information, which includes things such as the patient's name, age, name of their surgeon, and type of surgery that was performed. It improves the inclusion of pertinent details concerning your patient, such as allergies, drainage tubes, and medications given during the perioperative period. It reduces the rate of errors in reporting because you do it the same way every time, every patient. It eliminates redundancy and confusion during handoff. It increases the success of the handoff of patient care and decreases the risk to patient safety associated with communication errors. Okay, so I understand why patient handoff is important, but what should I include in my handoff report? Name and age of patient, pertinent information such as allergies, precautions, do they have C. diff or a history of seizures, prior surgeries and hospitalizations, medical history, are they diabetic, do they have uncontrolled hypertension, and any physical limitations. What type of surgery was performed and who was the surgeon? Some surgeons have very specific ways they want their patient cared for in a PACU. Type of anesthesia given. Were they completely sedated and intubated, or was a local anesthetic used? Did any issues arise with the patient during surgery? Perhaps the patient had been in normal sinus rhythm but went into atrial fibrillation. How much blood did that patient lose, and what type of volume replacement was given? What are their vital signs? Where is the surgical site? How did the surgeon close the incision? What type of dressing was used? Does the patient have drainage tubes such as Jackson Pratt's? And if so, where are they and how many are there? What IV sites do they have? Do they have an arterial line? What type of IV fluids were given during surgery? How much fluid was given? And how much credit is anesthesia taking for any fluid remaining in the bag upon arrival to PACU? This is important to properly document I's and O's. What type of medications has the patient been given? Do they receive antiemetics, opioids, blood pressure medications? How was pain managed during surgery to aid in pain reduction during the wake-up phase? Were any tests performed, such as finger-stick blood sugars, and were treatments given based on test findings? Were there additional assessment findings, such as abnormal lung sounds, or pulses that could not be located even with a Doppler? Make sure you review all post-operative orders given by the anesthesiologist as well as the surgeon. What are some attributes to an effective handoff? You should listen without interrupting. Allow time for questions and comments. Do not rush to get to your next patient or to do your charting. Discuss any pertinent safety issues. Describe potential problems. Verify information you are unsure of. Minimize outside interruptions, and provide opportunities to review patients' medical history. Well, you told me about effective attributes, but what are some barriers to a safe patient handoff? Incomplete transfer of patient information, such as you were not made aware that the patient has a known history of atrial fibrillation. Other communication issues such as mumbling, distractions, incomplete teams. The circulating nurse did not come to the PACU with anesthesia and left the report solely to them. Omission of pertinent information. The patient's blood pressure dropped throughout surgery and had to be maintained on a vasopressor. You might want to know that. Inefficient performance of clinical tasks and poor standardization in reporting. Recognized by JCAHO, such as SBAR, is one of the most Standardized report tools that are recognized by JCAHO, such as SBAR, is one that most of us are familiar with. The acronym stands for Situation, Background, Assessment, Recommendations. Another useful tool recognized by JCAHO is CUBIN, which stands for Confidential, Uninterrupted, Brief, Accurate, and Named Personnel. In conclusion, remember that handoffs can be especially dangerous for postoperative patients because they are unable to communicate with you during the immediate postoperative period and due to the rapid progression of patients through a PACU. Handoff starts when the patient leaves the operating room. There are multiple barriers to safe patient handoff, and above all, utilize teamwork because it takes everyone working together to keep our patients safe. I hope you enjoyed this video presentation.